Hello again. Welcome to another edition of Media Watch. I'm your co-host, Eric Tate.
I'm Bob Anthony.
I'm Raymond Peterson.
I'm their guest and friend, Alan Singer.
Educator, historian, Dr. Alan Singer is joining us for another session of Media Watch because his expertise is always invaluable to us. And this is being brought to you by the good graces of EVT Educational Productions, Manhattan Neighborhood Network, and Zoom. And we're again recording this the Wednesday before our Monday air date. With Dr. Singer doing some good research work on how things are progressing with who's getting vaccinated and who's not getting vaccinated. We thought we would try to do a show on vaccine hesitancy, anti-vax craziness, what's happening between various populations, Black, brown, white, and with that as an overview setup, Dr. Singer, tell us basically how this stuff is breaking down and how we should look at it.
Well, first, I think it's important to distinguish between anti-vaxxers and vaccine hesitancy. The anti-vaxxers, it's overwhelmingly a white right-wing movement that's part of the Trumpists, the Tea Party, that I don't have to do what you tell me to do, and I don't trust government. Vaccine hesitancy, especially in the African-American community, is a response to a long history of racist medical practices and experimentation. I mean, going back to slavery days, James Marion Sims, a noted gynecologist, experimented on African-American women without anesthetic, without consent, without antiseptic. In the 20th century, the United States Medical Service experimented on African-American men in the South, in the Tuskegee experiment, and they watched them die from syphilis that could have been treated, but they wanted to watch the process of the disease. Fannie Lou Hamer in the 1960s was a civil rights leader from the Mississippi Delta region. And as a young woman, she had a hysterectomy that was not necessary as part of a campaign to sterilize African-American women there. I mean, there's this long history of medical abuse. Even today, people involved in experiments that don't require informed consent are overwhelmingly African-American, and pharma companies use Africa to test new drugs. So that there's a level of skepticism about medicine that it's rooted in this history. So I distinguish between that right-wing anti-vaxxers, which is overwhelmingly white, and the vaccine hesitancy in the Black community.
Okay, but we have a problem, as we all know, in that we've got a lot of people with large platforms on social media. And a lot of young Black and brown kids don't read newspapers. They barely watch a television evening news show. And so they're getting all their input from social media, whether it's Instagram or TikTok or wherever, or just following celebrities. And so we know that Nicki Minaj cousin, friend of a cousin in Trinidad craziness about impotency in Black males took off like rampant wildfire. Bob, you were talking about the fact that the Trinidadian ministry had to have a press conference to tamp that down.
They basically, yes, their head of health basically had to get on, I guess, worldwide news to say that it does not exist. We tried to track down this individual to see what happened since it involved our country, and no, it didn't exist. It was where it came from. He didn't know, and he said out loud, "We wasted our time with this." But I'm glad Alan made the distinction between the anti-vaxxers and the hesitants, because Blacks don't watch OAN, they don't watch Newsmax, they don't, I hope they don't watch Fox. They probably do a lot, but they're getting where they're getting the information, where the people who are hesitant are getting their information from is what I'd like to know. I don't know. It bothers me, like you said, Eric, that a lot of people don't read newspapers or the network news. So I wonder, is it just social media? I guess that's what we're discussing today.
It appears that way. I know adults that only get their news from social media or hearsay. And I think that's very common these days, unfortunately. People don't trust the media anymore. I'm beginning not to trust the media anymore.
Well, we all know that there's quote media and then there's quote media.
Right,
And
exactly.
so
I'm beginning not to trust the legitimate media because I read the Times and I see typos in the Times.
We could go down the rabbit hole of how bad professional journalism has gotten or how good it has gotten.
I'm just saying.
Yeah, there are many examples of that. What scares me, but Alan, you could speak to it, is the impact of a celebrity culture per se that may or may not help us in this current paradigm that we're facing ourselves in. Because the latest iteration of Nicki Minaj craziness was Kyrie Irving, the NBA player for the Brooklyn Nets. Irving, who is, Alan, you've done more research on this guy than I have even, and I'm an NBA fan, as opposed to an NFL fan. I'm an NBA fan. And the bottom line is the NBA has not mandated vaccinations for their players. And one of the things we can get into later is the efficacy of mandates, but the NBA did not mandate. And so players like Kyrie Irving, who large following, big star, came out with his, I'm not, my personal choice, I don't want to talk to you about it right now. I'm not going to give you my vaccination status. Alan, what's been percolating in mainstream media and otherwise around Kyrie Irving and around other NBA players?
Well, the thing with Kyrie Irving is he's a bit of a nut certified. Kyrie Irving was on a championship team with LeBron James and demanded to be traded. I don't get that one in Cleveland. But Kyrie Irving also announced that the earth was flat because he didn't believe it was round. So
right.
The thing with Kyrie Irving is that even though the NBA does not require mandate vaccination, New York State does. So that Kyrie Irving will not be able to play in Brooklyn at the Barclays Arena with his team or at Madison Square Garden unless he's vaccinated. And so far, he has stood up his teammates. It's not just that he has ridiculous opinions, but he's supposed to be a team man. Clearly, he's not. There are NBA players, however, who have taken a stand. The most prominent, of course, is LeBron James. Now, he has said it was a personal choice, but he said his choice was to protect his teammates and to protect his family from a deadly disease. And so I have to really credit LeBron. One of the people who's always been my personal hero since, I guess, well, I'm his contemporary. I guess you are also, Eric and Raymond.
Yeah, he's actually a little behind me, but yeah, I'm his contemporary.
Kareem Abdul-Jabbar. You know, I was in.
My contemporary.
Yeah. And Jabbar is also a very educated, very literate man. And Jabbar has written a long piece. And if I'd like to quote from it, because he is such an effective spokesperson.
Feel free.
He wrote, "It's so shocking and disappointing to see so many people, especially people of color, treat the vaccine like it's just a matter of personal preference, like ordering no onions on your burger at the drive-thru. Well, I can understand the vaccine hesitancy of those who have been historically marginalized and even abused by the healthcare system. Enough scientific documentation has been given to the public to set that past behind us for now. Yes, we should never forget those experiences should sharpen our critical thinking to not accept things blindly but it does not mean we reject things blindly. The drowning man does not ask if a racist made the life preserver keeping him afloat. And then he concludes, those who promote hesitancy and more research have blood on their hands. Worse, the kind of conspiracy theories of pseudoscientific pundits spread is the kind of selective science that white people used to justify enslaving Black people.
Amen.
Yeah,
Now,
he's always,
this is so well said by
Well,
Kareem, and unfortunately, he's our contemporary, not young people's contemporary.
Yeah.
So I don't know what effect he has on young people today, even though he's he's still the all-time NBA scoring leader. But young people would rather listen to Kyrie and
Yeah.
hopefully LeBron.
hopefully LeBron. Interestingly enough, we on Media Watch tried to go down the path of discussing the hesitancy on Black people earlier on. And I remember we talked about the young Black scientist who was working at NIH, who had been researching all this RNA material dealing with these kinds of infections, the various COVIDs that had come down the pike earlier before COVID-19. And so she had like a 6-year head start on this stuff. And so it was her early research that helped jumpstart the Moderna vaccine. So we made sure we highlighted the fact that this was a Black female scientist, MD, research fellow at NIH, who I believe one of the other shows, like MSNBC or somebody, actually walked her through a local drugstore in Philadelphia so she could convince a son and a mother about the safety of the vaccine. And, they gave that interaction big play on major national television, cable, whatever. And Alan, we're still in that mode of trying to demonstrate, because you came across, what was it, a CNN Heroes, another female doctor who, if you can call up her name and what her stuff was, I'll try to find the video and maybe I can roll in a section of it while she's talking to young Black males about the efficacy of a vaccine and why, even though they're skeptical, because she had been skeptical herself, but did her own research, why she wants them to take the vaccine. Can you call her up by any chance? I can try to call up the video and share the screen.
I have the video on another screen, Eric. I can roll it in. Did you want it rolled in like a minute in or so?
Yeah, I got it queued at about 107.
I'll try to do that.
So that's where I was going to try to cue it in. If you give us a little background on her, Alan, before I share screen and try to roll it, go ahead.
All right, her name is Dr. Alice Stanford, and she organized the Black Doctors COVID-19 Consortium to bring testing and vaccinations to communities of color that were hit hardest by the pandemic. She's based in Philadelphia. But one of the things that I liked about her was that she has spent time sitting down with groups of students to address their concerns and explain why the vaccination is so crucial and why it's safe. And I like that part especially.
Fantastic. So I'm going to try to share the screen and try to roll her in. I think that's what I want to share. And let's roll it in.
Because it hasn't been around long enough for you to study it. But what we do know is that if you get COVID as a young Black man, the chances of you not surviving are higher than you taking a vaccine that we don't know what happens in 10 years. Meaning the risk is greater for you to contract COVID than it is for you to take the vaccine. Does that make sense? Okay, because we've watched it for 14 months, what happens when people get coronavirus disease. And we know that Black and brown people have contracted at a rate 3 times greater than white Americans in the United States. And we know that the death and the disease rate is higher in Black and brown communities. And we know that even if you don't die from COVID, the likelihood that you'll still have effects after you've had COVID is higher.
So yeah, how much more, let me see if I can quit sharing screen. How much more plainer can you get than, it's not in your best interest to not take this vaccine, because the long-term effects are going to be detrimental to your health.
The information is out there, Eric, and she is as eloquent as anybody I've heard on the subject. And she put it in simple terms, not sometimes you see Dr. Chokshi on the TV. And it's
the New York doctor.
Yes, and it sounds so technical when he says it, but she's so straightforward. So I'm glad you rolled that little clip.
Yeah, Alan, thanks for flagging her, because if your own medical experts in your population have done the research, have done their personal research into the efficacy and safety of the vaccine, who else are you going to believe? Some crazy QAnon stuff that you're reading online, or somebody like Nicki Minaj who's talking about my cousin's friends, that nobody can find the cousin, much less the friend of the cousin or whatever. I'm at a loss. But look, let's talk about how we can help move this along. And Alan, you'd mentioned something about mandates earlier, or was it you, Ray, that mentioned mandates?
Oh, no, in terms of the mandates, I'm just saying, I think that there's a bunch of people out there that are anti-vaxxers simply because they're being told that they have to take it. I think if they weren't told, they would do it. Many of the people that are lining up to get flu shots are not lining up to get the COVID-19 vaccine. And that doesn't make any sense to me. The only thing I can come up with, and I'm not talking about the non-believers, I'm talking about the people who don't really have an opinion, they're just being contrary. And that I don't understand, because the bottom line is that you don't do it for yourself, you do it for other people. Of course, you're concerned of your own health, but I do it. I was concerned with my health, but I've been vaccinated, I'm fine, but I still wear my mask. I wear it for other people, because it's not just about me, it's about us as a community, the world community. And I don't understand why people don't understand that.
I'm glad you said that, Ray. I was at an event yesterday, as we tape on Wednesday, and it was a rooftop event, and most of the people didn't wear a mask. When we lined up at the buffet for food, I put on my mask. I was doing it for the other people in line. And, I don't care if it was a rooftop, we were close together. But that you make a great point, Ray.
At Hofstra,
Where are we on mandates, Alan?
okay, on Hofstra, all students to be on campus must be vaccinated and have proof of taking a COVID test. If they don't have proof of vaccination in the test, they cannot attend on-site classes. And I know personally, and then if you're in a building, you must wear a mask even if vaccinated. Now, I'm over 70 years old. I'm at risk, even though I'm fully vaccinated. So I'm very glad that Hofstra has pursued that policy. I know that there has been good news lately that gives us hope. The Kaiser Family Foundation just released a survey that says that the racial ethnic gap between vaccination has now almost completely disappeared amongst adults, and that each group of adults in the United States, Latino, African American, white, has at least 70% one vaccine.
So the
new
gap,
requirement that healthcare workers must have the corona vaccine in order to work appears to have pressured thousands of holdouts to receive last-minute shots. And teachers in New York City and all public school employees are going to face that same mandate by Monday. So those mandates also seem to be having an important effect. People don't want to lose their jobs. People want to be able to go to work or to school.
Right, but there are nurses that are walking off the job rather than be mandated. According to the local news that I'm watching here in New York.
That's correct.
Very small numbers.
That is
Very
correct.
small numbers, but I just don't get it. These are healthcare workers. They're dealing with people that they're trying to help, to keep them from getting sick even further. So why aren't they wearing, what's the opposition there? I don't understand that at all. These are healthcare workers. They know better. They understand the science. So what's going on there?
Again, I think.
And I don't want to take away from our general conversation, but
No. Actually, that is germane to this discussion, because when you have nursing home workers amongst the most vulnerable population refusing to get vaccinated, only a mandate is going to make them get vaccinated. And of course, they're going to have to choose, which they are now choosing, because in New York State, to work in a nursing home, you better be vaccinated or you lose your job. And the governor, correct me if I'm wrong, the last report I heard was, if things get bad enough in the nursing homes or the hospitals, she's looking at activating National Guard healthcare workers to help fill that gap, because she's not backing down on those mandates to take care of the vulnerable populations, the sick people who are in danger, who need people to be vaccinated, working on them, working amongst them, with them. She said, we're not backing down on that. So I'm in full agreement with mandates. I remember when Joe Biden first put the mandate in, the CEO of Delta, I believe it was Delta, was very grateful and said, yeah, we're following that lead. And he immediately mandated the Delta employees be vaccinated. I'm just surprised that more corporations are not taking shelter behind a federal mandate wherever it exists, because OSHA mandates safety in the workplace. So they can easily hide behind, if you want to call it hiding behind anything, federal regulations where OSHA demands that there be a safe workplace, no matter where you are in the country. And so you can say, to have a safe workplace, my workers need to be working amongst vaccinated, tested, fully able and protected workers, so that their safety is not being compromised. Tell me I'm wrong with that reasoning.
Right. That's why I think we're looking at the remnants of the Donald Trump right-wing political movement. And nothing else explains it to me. I mean, these are people who are refusing to be vaccinated because they're opposed to the deep state, big state, which is going to force them to do things. And you have still people, leaders of the Republican Party, are largely quiet. That, you have the DeSantis in Florida, you have the guy in Texas. They're not pushing vaccines. They're not pushing masks. They're arguing that the epidemic is past. It's not that dangerous. So if leaders of the right-wing Republicans are taking that stand, why should people voluntarily take an injection? And then you have people like Maxine Taylor Greene, who refuses to discuss her personal position on vaccination.
Marjorie,
yeah.
Marjorie.
Marjorie Taylor Greene. So we have a political party in the United States that is grossly irresponsible, and it feeds into all of this anti-vax behavior. And I don't think we're going to change their minds. As long as the right-wing media and the right-wing politicians think it's going to get them votes, they're going to keep doing it.
I saw a report today, this Wednesday, that we're taping before Monday aired, that I believe YouTube has banned all anti-vax COVID-19 disinformation.
Excellent.
I believe it's YouTube.
It extends to all vaccines, not just COVID. It
Yes.
extends to all bad vaccine info.
That's correct. And that for me is the model that Facebook, TikTok, Instagram, whomever, whatever, Twitter, every platform should come down like that. And we would be so much better off globally, because these social media platforms are global platforms. They're not national platforms. And so if they could mandate that kind of ban, and they could enforce that kind of ban, it would help the situation phenomenally.
Marjorie was taken down or banned from TikTok
TikTok,
temporarily
Twitter or
for
TikTok.
posting vaccine misinformation.
Mhm,
And
mhm.
we have about a minute and 50 seconds left.
Okay, what's a good way to wrap this up in that minute plus? Because the NBA has not mandated. My advice to the NBA, mandate a vaccine to all, for anybody to be able to play in your league. Nobody can sue you because you're trying to enforce a safe work environment for your, if arenas can mandate indoor mask wearing and vaccination, you can do it for your players and your league. I agree with Governor Hochul, Mayor de Blasio about whatever mandates they're saying about public school workers, because those kids who can't get vaccinated are being endangered. You guys talk to me about what the federal government can do or cannot do. They can mandate for federal workers, but what other leeways do they have?
I mean, you can't do financial. You can't like say we're going to raise your taxes. So I don't know. It's going to be tough.
Well, I think
But they
what
can mandate it for federal workers and federal contractors, can't they?
Yeah, I would think they could. Yeah.
I
And
think
we have
to
about
take-
30 seconds.
I think we have to take Nicki Minaj on face on. So what we need to do is we just got to go out and rap back. You know, it's time to tell the truth. COVID history, vaccination is safe and free.
Amen. With that, this has been Media Watch, folks. I'm your co-host, Eric Tate.
I'm Bob Anthony. Catch up to us on Twitter and YouTube at Media Watch EVT.
And I'm Raymond Peterson. Be part of the solution, not the problem, please.
I'm Alan Singer, and thank you very much for having me this evening.
Dr. Singer, thanks
No, it
once
was a
again for
pleasure.
joining us. I really appreciate your expertise and willingness to join us on these sessions. Folks, we'll catch you the next time. Stay safe.